Good evening, everyone, and welcome to the Thriving Dentist Expert Panel. Now, today's conversation is AI in your dental practice in 2026. What's actually working, what's risky, and what's next? I'm Angie, and I will be your moderator tonight. AI is appearing across almost every part of dentistry, from clinical imaging and home monitoring to patient education, scheduling, insurance, and communication. But the important question is not simply whether a product uses artificial intelligence. The question is whether it improves a meaningful decision, protects patient trust, fits the workflow, and creates enough value to justify the investment in risk. Now, before we continue, I also want to mention that Jen Griffin was originally scheduled to join tonight's panel. So, unfortunately, Jen is unwell and will not be able to be with us. We are definitely sending her our very best wishes for a quick recovery. But don't worry, we are still in excellent hands with Dr. Julia and Dr. Mora, who will help us explore patient-facing AI, home monitoring, clinical trust, access, workflow, compliance, and what may be coming next. Now, a few housekeeping notes before we begin. We are recording tonight, and you will receive access to the replay afterward. But hey, do not let that make you passive. The real value is happening live. So use the Q&A button for questions you would like our panelists to answer. Use chat for reactions, examples, and conversation. With that, let's begin. Now, before we meet our panelists, we would like to thank Echo Marketing for sponsoring tonight's program. Led by CEO Naren Aruraja, Echo Marketing has more than 18 years of experience supporting over 500 healthcare practices across the United States and Canada. Their work helps dental practices strengthen search visibility, build conversion focused websites, develop content and social authority, and turn online interest into booked appointments. The insight on the slide is simple. More inquiries should become more booked appointments. That begins with attracting the right audience, earning confidence quickly, and giving prospective patients a clear path to schedule. So we will hear more from Ecuador a little later in the program, so stay tuned for that as well. Um, Here is where we are going tonight. One, clinical AI in 2026, what is earning its keep and what is still hype. Two, the back office AI opportunities, including scheduling, insurance, recall in phones. Three, AI in your patients, what builds trust and what backfires. Four, the risks that are not always discussed openly, including HIPAA, liability, and over-reliance. And five, where dental practices should place their AI bets during the next 18 months. So let's get to our panelists and into the work. Our first panelist is Dr. Julia Michelin, an international dentist, entrepreneur, speaker, and author focused on the future of artificial intelligence in oral health care. She is the founder and CEO of LumaBrush AI, a dental technology company working to turn daily brushing into a more preventive and measurable routine. LumaBrush is developing a toothbrush with an integrated intraoral camera designed to give people clearer visibility into their oral health at home and support earlier identification of potential concerns between dental appointments. By combining user-friendly hardware, structured image review, and clinical expertise, the company aims to help patients and dental professionals manage oral health concerns earlier and more effectively. Dr. Julia is also the author of The Future of Dentistry, How AI Will Change Everything. Dr. Julia, thank you so much for joining us tonight.
Thank you so much. It's a pleasure to be here. Thank you for this lovely introduction.
Our second panelist is Dr. Leonora de Oliveira Mora, a dentist, AI researcher, and founder of Dental Vision AI. a free HIPAA-compliant platform developed to support the detection of dental pathologies on panoramic radiographs. Her work is focused on expanding access to specialist level diagnostic support, particularly for underserved and Hispanic communities. Dr. Mora also serves as a thought leader for Teeth Cloud, a global dental informatics network representing 39 countries. Dr. Mora, thank you so much for joining us tonight.
Thank you. It's a pleasure to be here tonight. Thank you so much.
All right, I'm going to stop sharing the slides so we can begin the conversation. Dr. Julia, I would love to start with you. So, how can patient-facing AI tools help people better understand their oral health and take action before their next dental appointment?
Oh, I think we are living a really interesting moment in time. Everyone is using AI. When I
Mhm,
used to have this conversation back in some years ago, we were talking about the future, talk about people are gonna use AI, people are gonna be interested about the technology. Now it's a completely different scenario. Everyone is using AI. The patient is using AI. Even sometimes before they realize the first symptoms, they use LLMs, the large language model like ChatGPT, to search
mhm,
the condition. And what is happening nowadays is to monitor what's happening with our oral health. The patient it's receiving information maybe once or twice a year about their own oral health when they go to the dentist.
mhm,
So the shift that we're seeing is the shift of the mentality. Instead of this patient that waits to receive their oral health information from the dentist, now they're having access to these tools that can actually search and receive information from it. And this is basically one part of we are doing at LumaBrush. So it's giving the information, giving the knowledge to the patient through a device that they can use at home.
mhm. Yeah, let's bring that into a real world example, right? So with you were talking about Luma Brush. You're combining a toothbrush with an integrated intraoral camera. So how does that visual access change the way patients understand their oral health between visits?
So the camera connected to the brush, it's literally a device when the patient at home can scan. So basically they can use the technology to take photos and videos. AI analyze these photos and videos and give a score and a recommendation based on that photos. So a lot of areas inside our mouth, for example, the back molar, we cannot even see it right at home without
Yeah.
going to the dentist, without the mirror, without this. Until now, now we have the technology is available, it's evolving. So the patient at home is able to actually see it, what's happening, and receive the recommendation through the AI.
Yeah. Dr. Mora, so from a clinical trust perspective, what would need to be in place before a dentist could confidently use or discuss images collected by a patient at home?
I would say that tools like that survive the workflow as the dentist already has, right? It's right there with the x-ray, and it's not like a separate app, especially with this toothbrush. That's amazing tool right there they have in their hands. It's not an extra login. It's the ones, I think those are the ones that get abandoned, usually fail on trust or not being occurrence, right? It's too many false positives. For example, the clinician just starts ignoring the alerts. I
Mhm.
think transparency matters too. If the two can flag something and show the dentist, then it becomes like not just noise, it becomes a support.
Yeah, that's amazing. Dr. Julia, does that clinical perspective affect how the information should be presented to the patient through the technology?
Absolutely, 100%. So everything that we are developing right now, every tool that we are using, even as a patient, as a dentist, as a user itself, right, need to bring some benefits to us, right? So now we are seeing actually the case that AI actually bringing into the real world, to the real life, and help us, right? It's a daily use that you use, and actually is bring benefits from you. So what we are looking for, especially with Luma Brush, it's accessibility in dentistry. So we know that a lot of aspects of dentistry we need to improve. One is communication with patient. That's where a lot of tools are being really useful, even inside the dental practice with 2D and 3D image analysis helped by and powered by AI. And then the tool that LumaBrush does, it's a complementary skills to improve communication, to actually send the patient to a dentist easily, because through LumaBrush you can actually connect the booking system and send the patient to a dentist
Yeah, we had a bit of a glitch, Dr. Julia. If you could just repeat that part.
Yeah, I fell here as well. Can you hear me okay now?
Yes, much better.
Okay, good. Okay, good. So basically, what I was talking is we, as even as a user, as a patient and a dentist, we use the technology that is useful for us. And the way that LumaBrush does its focus on accessibility. So even connect to a patient to the dentist when any kind of condition is detected.
Mm-hmm. Dr. Mora, what separates AI diagnostic tools that are earning clinical trust right now from the ones that are quietly abandoned within 90 days?
That's a really good question. I think, as I was saying, I think it's something that has to be right into the dentist workflow. It's something easy. It's not, you don't need to go for extra logging. Let's just say that the ones that get abandoned very fast is the one that fail, the one that gives too many false positives. It's those are being ignored by the clinician itself. And the trust that you build with the patient, it's right there in front of the patient. You have to, not show something that it's going to put you in a position that you have a second guessing tool like this. And dentists won't act on it. It just become something that is not supportive, I would say.
Practical for practice owner, right? During a vendor demonstration, what are the first three questions a dentist should ask before trusting the technology?
I would say to trust, it would be a HIPAA compliance. That's the first one. That's the first question a dentist should make before, even if it's a free or a paid tool like this. And also if it's reliable, if it protects the data, the patient data, um, like if a responsible vendor, free or not, should be transparent about their compliance posture upfront, right? If they can't answer that clearly, that's a real red flag. Not price, not anything else.
Dr. Julia, I'd love your perspective as well. So, from the patient-facing side, do those trust standards change when the technology is being used by patients at home rather than by trained team inside the practice?
Absolutely. Even in this AI era, some things is still really important when we talk about technology. One is trust. They need to trust about the technology. They need to understand how the ethics aspect of it. Data protection is really important nowadays as well, always being really important, and the bias. So I think that's the main thing that everyone is really worried about.
Dr. Moore, I'd like to get back to you as well. Is there one standard that should remain non-negotiable in both settings?
Um, yes, I think I'll give an example. If it actually becomes a trust building moment instead of a walker one, if the patient can turn the screen and say, here's what the AI flagged, and here's what I'm seeing too, the patient feels like they're getting a second opinion in real time, not like a box of decision, right? The visual in this specifically moment, the clarity is what makes the flap usual instead of just noise.
Yeah. Dr. Julia, what should dental practices look for when evaluating an AI tool designed for patients to use at home?
I think, of course, it's really important. The goal to those tools that the dentists are going to choose is first, what is bringing patient to them, what patient is trusting. So what the user is actually using and trusting to the device, what is getting the patient back to the dentist, what is actually preventing something. And I think it's really important, especially in this moment in time, that the technology actually solve a problem. So luckily for us in dentistry, we have a lot of problems to solve inside the dental practice, outside the dental practice,
Right.
accessibility, social aspect, healthcare. So I was even I went to the hospital with a friend lately, like during the weekend, and I was even paying attention into like healthcare because I'm based in Dubai right now. I live in Dubai, so I was even like paying attention to every step that's happening inside the healthcare care. So, for
Mhm.
example, he did this. He went with this injury, and then he went for a initial X-ray, and then after the X-ray, the doctor came back and say, now you need a CT scan, and now we need to go to another doctor, and now another doctor. And I was even noticed that in any point of this consultation, the doctor actually showed the X-ray to the patient. Or now imagine a different scenario. When the patient came to you, you do X-ray. You not even show the X-ray to the patient, but we show with AI analysis. Because one thing is you showing a black and white image. The patient had no idea. He didn't do 5, 6, 7 years of dentistry, right? Another thing is you show this image with X-ray analysis by AI when you have different colors, when you have different annotations. So this actually feels like small things, but change completely the way the patient is gonna trust you. And the home device, the monitors device, it's the extent of this care.
I'd love to
Mm-hmm.
acknowledge one of the things that our audience had entered into the chat. Brett King, uh, they said this raises the issue of data sovereignty. Can patients take their own data scans with them, and do they know how their data used with AI, training, etc.? Is there anything maybe Dr. Julia, Dr. Amora would like to say for that?
This is literally the case that I said about my friend during the weekend. And the data, the X-ray that it was took,
Mm-hmm.
in any moment of the conversation was actually give to the patient needs to request it. It's really important to understand that, especially this moment in time again, data, it's really important. And health data, medical data, it's really because we deal with data privacy, we did it with data from the patient, but at the same time, to train a model, we need data. And the
Yeah.
only way to make this health, to improve healthcare, to improve outcome of diagnostics and everything, we need medical data. So this is a really interesting conversation that we need to have, and we need to keep this conversation going.
Mm-hmm. Thank
Exactly, especially with different countries, they have different policies and rules. The data, it's not something easy to get it from, right? And also, I was reading an article a couple months ago about this. It's a very interesting thing. We have this rules right now that the patient has all the data is into office, into a practice. And for the future, maybe we should be looking at something that maybe the patient will carry the data within. This is a very interesting topic to discuss too.
Yeah, for sure. Thank you so much, Dr. Mora and Dr. Julia. Now, getting back to you, Dr. Mora, how do you weigh the diagnostic access benefits of free AI imaging tools against the compliance exposure when a vendor agreement has never been properly reviewed?
That's a really good question right there. Um, for example, this type of things, it's usual. It's a new AI is a new tool, right? The flag needs to be support, and then uh, if the AI has like a second guess in front of the patient, it creates this hesitation instead of just confidence. I will also look at the time of like resubmission and deny claims, for example, whether the deny reasons are actually changing category over the time. If a practice kept getting denies, for example, for the same reason after the two, that's a sign that the two is fast but not smart, for example.
hmm Let's make that actionable for practice owners. Before uploading a patient image to any AI platform, what should a practice verify first?
What should I practice verify first? I would say the rules, the data, which is the most important.
Mm-hmm. Yeah. Dr. Julia, I'd love your perspective as well. When a patient-facing device is collecting information at home, what should patients clearly understand about how their images and information will be used?
And it's a really interesting question as well. I think the main point of taking photos and videos and collecting data, their own data, is because they want knowledge, right? So I think knowledge is really important. The way you explain the condition is really important as well, because even when we talk with or disease and disease in general, we have the progress of the disease. So even then, the dentist, the doctor need to come in and say, now it's time to treat, now it's not. So it's really important that AI help as information, as early diagnostics to bring to the care, but it's important that the final decision, it comes from the doctor, from the dentist.
Mm-hmm. Dr. Moore, I'd like to get back to you as well. What should the practice do when the technology appears clinically valuable, but the vendor cannot answer those questions clearly?
Uh, I think the vanity, like it's a metric, and the number that actually matters, it's whether the tool it's improving the diagnostic, right? If if the dentist cannot have a clear vision about that in front of the patient, that's a real red flag over there. Maybe he should start looking for something more versatile.
Mm-hmm. All right. Dr. Julia, how can AI-powered home monitoring complement dentists and improve preventive care without attempting to replace clinical diagnosis?
In a lot of ways, so many ways, because the disease or the patient, the disease didn't stop to involve when the patient get out of the dental practice, right? So it's the health is consistent.
Mm-hmm.
And so the tool, I think, are you with me, right?
Yes,
Okay,
yes.
good. I think, okay, good. So basically, it's the tool that you use at home is a complementary of the care that you receive from the patient. So now we are seeing people are getting more international. We are, you see, like digital nomads. So the care cannot stop. because of location, because of where the patient is. So this kind of tools like LumaBrush help us to monitor the oral health in a way more consistency.
Mhm. Dr. Mora, if you don't mind me asking, from a diagnostic perspective, how should a dentist treat a pattern detected through home monitoring before deciding that it is clinically meaningful?
I would say that the key word here it's a complement, right? If
Mhm.
the two has to succeed position themselves as a bridge to the dentist, not a substitute, I would say. Um, Flagging, for example, something that and saying brings this up to the next visit, for example, that rather than making diagnostic on their own, that's the real key role over here. It's just like a complement to instead of just a diagnostic tool.
Mhm. All right. Dr. Moore, back to you. So, when a dentist reviews an AI flagged radiograph finding with a patient already in the chair, what needs to be true about the workflow for that flag to be genuinely useful rather than quietly ignored? Dr. Moore?
I'm sorry, I couldn't hear the
Yeah, all
question.
right. Let me repeat the question. When a
Uh-huh.
dentist reviews an AI flagged radiograph finding with a patient already in the chair, what needs to be true about the workflow for that flag to be genuinely useful rather than quietly ignored?
I would say it's the support, the annotation, for example, and also why it has to be a reason, right? Why that it's being flagged. If the dentist, and it also has to be fast and visual because then he can interpret in seconds, not something that the dentist has to stop and decode while the patient is right there in front of them and watching. The flag also needs to be support and the dentist support to the dentist judgment after and not challenge it. It feels if it feels like a AI is a second guessing the clinician in front of the patient, it creates not trust at all.
Yeah. I'd like to put that into the chair side moment. What should the dentist do first when the AI flag and the clinical examination do not, immediately agree? Dr. Mora?
I'm sorry, I think we are having a glitch here. I can't hear much.
Okay. Let me,
Just let me just connect here.
yeah.
There we go.
All
Okay, can
right.
you hear me now?
Yes.
All right,
Perfect.
perfect.
All right. So what I was asking was, what should the dentist do first when the AI flag and the clinical examination do not immediately agree?
I think I think there is we have to put in front of the patient as a supportive diagnosis, right? Because in the end of this appointment, the patient trusts the dentist, the clinician, and the AI has to be something that it can complement their own diagnose. So if he
Mhm.
used that as a second tool, as a supportive tool, the patient will have the dentist trust.
Yeah, for sure. Dr. Julia, now from the patient communication side, how would you explain that disagreement without confusing the patient or making the technology appear more authoritative than the dentist?
In my point of view, a lot of this divide, like second opinions, for example, from AI and technology, need to be first analyzed by the professional. It's if you just show to the patient before you even analyze, this could generate some conflict in trust. So
Mhm.
I think first everything, all the technology, all the tools should be first. If you are talking about inside the dental practice, right? So I think should be analyzed first to the doctor and then go to the patient when the doctor already finalized the final diagnose, for example. And then they can use this device, this technology, this AI to complementary the diagnostic and to improve the trust. But in
Mhm.
this case, for example, when you're doing an examination, a clinical examination as a dentist, and then AI flags another condition, I think first thing you need to do is actually check the accuracy, because even sometimes as humans we have of course limitations, and sometimes it's the last patient of the day and we miss this small decay, and AI actually flagged to you. So this is in a good case, right? It's actually AI is helping you to actually diagnose better. Another case is you need to see if it's not a false positive. When we are looking with AI, we still are dealing with scenarios like annotation is really important in this process, but we still have some kind of hallucinations, we still have false positives. So we still need to check all the informations came from AI before we actually finalize any kind of diagnostics.
Mhm. All right. Thank you so much, Dr. Julia. We're going to take a little bit of a break at this point. I believe we have spent the first half of tonight building a useful framework, patient-facing and clinical AI. Now, the technology must help people understand what is happening, fit the clinical workflow, protect patient information, and maintain a clear role for the dentist. There is one additional layer that helps those improvements contribute to sustainable practice growth, making sure the right patients can find and trust the practice. Right now, a patient in your market may be searching for a dentist near me, help with tooth pain, or information about a treatment your practice provides. That person may be comparing practices through Google, reviews, websites, social content, and increasingly through AI powered search. The expertise and systems we're discussing tonight deserve to be visible to the patients who need them. That is where Echo Marketing comes in. For more than 18 years, Echo has supported over 500 healthcare practices across the United States and Canada. So tonight, Echo is offering every practice owner attending today a complimentary practice growth session valued at $900. The session is designed to help identify practical next steps across visibility, patient trust, systems, efficiency, and sustainable growth. So scan the QR code on the screen or use the link that our support team has placed in the chat. It takes less than a minute to reserve your session, and of course, there is no obligation. But yeah, take a moment to scan the code or open the link, and then we will return directly to the panel. I will give you a moment to scan the QR code. All right, let's get back into the discussion. Dr. Julia, getting back to you, what role will AI-enabled devices such as smart toothbrushes and intraoral cameras play in connecting patients with dental practices during the next few years?
It's a really promising tool.
Mm.
I do believe that we being a little bit futurist here, everyone in the future is going to have access to this device, that it's going to help. So it's going to be basically a camera, not just a camera, but a lot of technology attached to home device. So when you think about like 5, 10 years from now, a lot of kind of technologies are going to become more and more accessible. Some of them really interesting, like gene therapy, DNA sequence, saliva tests. So I think the camera is the first step. The camera actually gives the knowledge and you can use AI to analyze. But so with LumaBrush, for example, we have been to remote areas, uh, this late this year, early this year, we went to the Amazon rainforest, and even there, they use like technology like Starlink. A lot of people use the Starlink because it's a really good technology in remote areas. Of course, everyone has access to phone, so I do believe that everyone's gonna have access to this home device. This device, those devices are getting more and more accessible with time, and it's gonna be integrate with that really exciting technology that's coming into the next 5 to 10 years.
That's amazing. Dr. Mora, I'd love to get you into the conversation as well, if you don't mind. What clinical threshold should determine which patient-generated information deserves review, follow-up, or escalation?
Um, I would say that detecting, encouraging preventive care, it's a very important, and enabling a remote monitoring, right? If they can automatically share oral health data with dentists, send reminders to schedule appointments, for example, and make it easier for practice to engage patients before small problems become major. That's a key word over here.
Mm-hmm. Yeah, for sure. Again, back to you, Dr. Leonor. What makes an AI diagnostic tool genuinely useful and trustworthy in a dental practice? Why do some tools get abandoned so quickly?
I think the ones that get abandoned usually fail on trust, not curious. For example, too many false positives, right? And the clinician just starts ignoring it. And if the tool can show why it flagged something, like the explanation before the dentist get back to the patient, the dentist won't act on it. It becomes just a bunch of information, and the dentist, uh, they have their own thoughts, and they need to be right there in front of the patient. They need to be able to explain how things work. They are not going to pay attention in something that is getting more like a noise instead of a support.
Mm-hmm. Dr. Julia, I'd love your perspective as well on that. Let me repeat the question to you. What makes an AI diagnostic tool genuinely useful and trustworthy in a dental practice, and why do some tools get abandoned so quickly?
Well, I agree here with Dr. Leonard. I think this tool need to bring confidence and trust. So, for
Mhm.
example, if you're starting a new tool and all the time you're like, oh, but this is not right, this is not right, like it's giving me this option, but it's not. You try for 1 week and you say you don't try anymore, right? So trust, it's really important. Accuracy, it's really important, so need to be something that you it's actually helping you in some way, and not just not it's not right. So I think trust it's important and need to bring you something. So for example, this tool for diagnostics is actually to help the doctor, the dentist with the diagnostic. If it's not being helpful, if you cannot trust, of course you cannot gonna keep using and keep paying for it. So you actually need to receive or need to help you with the diagnostic in a good way, right? Actually being helpful, or if need to save time or save money, and time is money. So maybe if your receptionist could use it before go to you to book that appointment, so she could know which doctor you need to book the appointment. And this is are small things that inside a dental practice can cause some fraction and can actually help to waste time inside the practice, right?
Mhm. Yeah. Dr. Julia, I'd love to know this as well. From your experience, what should a dental practice look for before recommending an AI tool for patients to use at home?
I think before recommending any kind of AI, actually to be interesting the dentist to use and be comfortable with the technology, that's the first thing. The other thing is actually if it's connecting to the care. For example, as a dentist, I recommend this technology because this technology is bringing the patient back to me and it's
Yeah.
preventing oral disease. So this need to be, again, we talk about trust. We talk about how you can trust this device, or how can I trust that this device is being beneficial for my patient because I recommend it.
Yeah, that's amazing. Dr. Mora, I'd love to know now, free AI imaging tools can be attractive, right? But what risks should practices think about before using them with patient information?
I think it's data leakage for sure. That's why we rather have this compliance, like the HIPAA, for example. And for example, who is going to be liable if something goes wrong?
Mhm.
Right. That's a very important question. And protecting those data, it's right now the most important thing, not in order just to get the two working, but also to give the patient the trust to trust in the practice and also in the dentist. Um, yeah, I think that's the most important keyword.
Yeah. Dr. Julia, now when it comes to Luma brush, right? Uh, Sometimes patients might feel a little like that it replaced the dentist, right? So how can that AI-powered home monitoring support preventive care without making the patient feel that it replaces the dentist?
So in case for Luma Brush is one tool that can actually helps you to prevent oral disease, but the
Mm-hmm.
treatment that you're gonna receive, it's and the diagnostic self belongs to the dentist and to the doctor exclusively. So on even on the app, we have a lot of parts that it's a healthcare reminder, a reminder that the final decision is always with the doctor. And this is really important. But one thing that it's really important to dentists to understand as well, that the patients are getting even every day they're getting more familiar with technology. We are using in our daily routines, right? We are using every day a lot of forms of AI for search, to get a second opinion ourselves. So we are being familiar with technology. And when you think about the timeline, that for example, the first time that AI um, and got a FDA approval, for example, for 2D image was March 2022. And then
Mm-hmm.
another one, May 2022. And then for 3D image, it was 2025. So when you're thinking about timeline, we can think about this is quite recently, but at the same time, technology is evolving so fast. And we need to embrace, we need to learn how to use it. And for now on, when you think about the future, being really honest here, that's we need to actually learn how to use and teach the patient how to use it and what's the best tool that it is available. And it's just the start.
Yeah, that is such a great answer, Dr. Julia. Now, to bring our main discussion to a close, I'd like to hear from both of you. What do you see as the biggest opportunity for patient-facing AI in dentistry in 2026? Now, I believe, Dr. Julia, with your previous answer, you had some insights, but if you could give a few examples on how, patient-facing AI in dentistry in 2026 has become a great opportunity.
I think when you think about AI itself and the timeline about AI, we saw, for example, in 1997, the first time that IBM Deep Blue, the machine, beat the Gary Kasparov, the chess player, the world chess player. And then we start to see the first applications in healthcare itself. For example, 1998, with the first FDA approval, AI CAD detection for cancer. So we, on the AI timeline, saying like this, we have our first application like playing games, testing the AI in terms of intelligence, literally artificial intelligence, right? Comparing our intelligence to the artificial intelligence. And the first way that we used to do this, it was playing games. And then we saw the first applications in healthcare. When you think about dentistry, I I say this over and over because it's a great opportunity for our field as a dentist inside dentistry, because the patient most of time they have fear of us. They don't understand what's happening inside their mouth. They a lot of half of the planet, and I believe it's much more, suffers from oral disease, and this number is not going down, for the opposite, it's going up. So we do have here inside dentistry a lot of problems that we need to solve. And
Mhm.
again, the only way that we can help and we can improve this, it's using technology. It's actually developing technology to our field, bringing and embracing technology. That's the only way.
Yeah. Dr. Moore, do you agree or do you see a different opportunity as the bigger priority?
I 100% agree. I think AI has to bring a lot of several benefits to the patient, including, for example, this is some ideas that I was searching to develop for next. Um, Besides the early detection, which is great for the patient because the dental problems can be tagged before they become serious, right? And more personalized case based on individual oral health data, greater convenience through remote monitoring and virtual consultations, for example. This is a really new topic that people are starting talking about. Better treatment outcomes with more accurate diagnosis and improved patient education using AI, as Dr. Julia just talked briefly about it. And like explanation of conditions for the patient, preventive care with reminders and real-time feedback that encourage healthy habits. That's a really important topics to be discussed.
Mhm. Dr. Julia, is there anything in Dr. Moore's answer that adds to or changes your view?
No, I agree 100%. I think we're living in a really interesting moment in time. We need to embrace technology. We need to talk about technologies. We need to talk about the future as well, how we see our fields. How do you want to improve our lives as a dentist, the patient's outcome as well? And we need to embrace all the technology that is being developed nowadays in different fields, and we need to compare and bring to dentistry, because that's a lot of opportunities here and a lot of problems to be solved as well.
Dr. Moore, to close this out, what is one practical step a dental practice can take now to prepare for that opportunity?
I think it's adopting the tools,
Mm-hmm.
embracing the tools and using the technology now. As I still see dentists having this kind of judgment before having the tool, like, oh, I don't want to have a second guessing that's contradicting myself in front of the patient, or that type of issues happening. So I think dentists in general, they have to embrace the technology, they have to learn from it, they have to try, they have to give it a try, they have to make it a better. And that's how we can the evolution towards the AI and the technology has to be embraced in general.
That's amazing. Thank you so much, Dr. Mora. Now let us get into the favorite part of today's session. We are now opening the flow for live audience Q&A. So you can simply type your question into the Q&A box. If you would prefer to ask anonymously, that is completely fine as well. Use the Q&A button and include your role in the practice and the specific problem you're facing. Now, if you do not reach your question tonight, don't worry, we will email you the answers. Now we have Brett King who had asked a question. How are professional dental associations encouraging the use of AI tools in practice to give patients more confidence in the clinical diagnosis? Dr. Mora, maybe we could start with you.
Yeah, to give more confidence, you mean the question mentioned the tool itself or for the clinician?
Yes. So
Can you repeat the question? Sorry.
yes, let me repeat the question. How are professional dental associations encouraging the use of AI tools in practice to give patients more confidence in the clinical diagnosis?
I think it's just giving a try, and also the dentist needs to check the occurrence of the tool, of course, before putting in front of the patient, right? Because if the occurrence is not high, the patient will not develop that trust, especially for first time patient, for example. If it's a new patient, um, that trust needs to be built first, and then using a tool that it's going to put the clinician into that position of not building that trust in the beginning, especially for first consultation, it's a red flag. And yeah, I think before the clinician needs to certify that the tool it's the occurrence is high in order to provide for the office.
Dr. Julia, is there anything you would like to add?
I think that's a great question. And I think it's really important here for us as a dentist to understand is that the patient it's looking for a professional, especially nowadays, more than ever right now.
Mhm.
But the patient's actually looking for professionals who positions themselves as technologists to embrace the technology. So you're seeing here a big gap between the dentists who actually embrace this technology and use tools, AI tools, and the dentist who is not using. And this is just gonna increase in the future. So, for example, you have every day you have a new technology, a new tool. In the future, this number is going to be even bigger. The dentists who actually use this technology learn to use it into the early days. And when you think about timeline in dentistry, early days mean like 2022, 2019. But now it's time, we still have time. We are still in an early phase, for example, for intraoral scanners, analyze intraoral videos and intraoral scanners. So it's still that's still time to be part of this technology shift,
Mhm.
and you can have 100% sure that the patient see it, the patient see all the technology that you're using inside the practice, and the more you use, more they feel comfortable.
Yeah, that is such an amazing answer, Dr. Julia. Thank you so much. Earlier during registrations, Brett King had asked another question. How could AI help shift dentistry towards more preventive and regenerative care? And how soon might that change become realistic? Dr. Julia, maybe we could start with you.
Well, this question is it's the question that I have been doing since I started dentistry. I always thought I was too social for dentistry. I was like, I want to fix the accessibility problem, how bring more people to the dentist and everything. So when I saw actually that now we have this tool that it's an intraoral camera connect to a brush, I was like, and when I saw the AI models getting really, really impressive good in a lot of fields, I was like, okay, that's the moment. So basically, Luma Brush is the result of this, how we bring the gap between all the more than half of the planet who has oral disease, and how we actually prevent, so our kids, the future generation, don't need the trauma of the dentist anymore. They feel comfortable going to the dentist, and actually we can actually prevent all this oral disease.
We had another question as well. This is from Amin Tiwari. Amin Tiwari asks, is AI safe when it comes to patients' privacy and confidentiality? Dr. Moore, maybe we could start with you on that.
Yeah, sure. This is a really good question. Yes, and if there's, let's just say there's two different sides of this conversation, right? When you bring it to extra logging, for example, like a platform, a tool that it's out there, and it has to be, in order to work, in order to be trained, it has to bring the data into it. And this is one type of AI. It's a really good question because there's two ways to train these models, and another way to get even more to protect this data even more. It's putting, instead of extracting the data and putting to the model, it's actually putting the model into the data. For example, the office has their own data. They have all the X-rays. They have patients' treatment plans, they have the patient medical history and everything. So the AI goes into that data and learn from it. And then she's going to have, like, I'll call, the AI is going to have a bunch of data that she learned instead of just the data inside the AI and out there. So this is a really good topic because there's a bunch of people already training these AIs in this way, which it doesn't need to be putting the data out there.
All right. Thank you so much, Dr. Moore. We are closing the live Q&A right now. But again, like I said, if we haven't reached your question tonight, don't worry. We will definitely get back to you within the day. Now, once again, a quick reminder, your complimentary $900 practice growth session is still available. Scan the QR code or use the link in the chat to reserve your session. We are coming into the home stretch, so I would like to ask each of our panelists the golden rule before we leave. So, what is the one rule a dental practice should follow when evaluating or introducing AI during the next 18 months? Dr. Julia, please start us off.
Interesting way to finish. I just want to add in here like a final thought that in this is my point of view, that it's being there strongly. That's two type of dentists in the future. So one who use the technology and embrace the technology, and the other one it's gonna be replaced by the first one. So let's learn technology, use AI to learn about AI. More than everything, now we are living there's a really interesting moment in time. So that's my final advice. Don't be afraid of technology, embrace it.
I like what you said. Use AI to learn AI. That is something that I think everyone should keep in mind. Dr. Morat?
I would say that use AI to support clinician judgment. That's the phrase I would leave with you guys. It's AI can assist with diagnosis, treatment planning, workflow, right? A bunch of clinician remains responsible for evaluating the information and applying professional expertise, right? And making the clinician decision as well. So patients' safety, ethics, and informed consent, for example, should always come first. So I would say number one rule here would be that.
That's amazing. Thank you so much, Dr. Moore. And now, tonight's clearest takeaway is that AI earns its place in a dental practice only when it improves a meaningful outcome, fits the workflow, protects patient trust, and keeps qualified human judgment visible. Now, as you exit the panel, a short feedback survey will appear in your browsers. Please take a moment to complete it because, of course, your feedback helps us improve future Thriving Dentist panels. Dr. Jolia and Dr. Mora, thank you so much for the clarity, expertise, and practical guidance you shared with us tonight. We also send our very best wishes to Jen Griffin and hope she feels better soon. And to everyone who joined us, thank you for your time, your questions, and the work you do for your patients in teams. I'm Angie, and we will see you at the next Thriving Dentist panel. Good night. Thank you so much.
Thank you, guys. It was a pleasure
Thank
to be here.
you.
Thank you so much.
Thank you so much. Thank you
Thank you.
so
It
much,
was a
Dr.
great conversation.
Amazing. All right. Have a great day.
Have a great day.
Thank you so
Bye.
much. Have a great day.